Welcome to the deep dive. Today we're plunging into a topic with a name that, well, sounds a bit gentle, doesn't it? Sleepy Foal Disease.
It really does. You might picture a foal just having a nice little nap.
Exactly. But the reality for these newborn foals is anything but sleepy. It's actually a very rapidly progressive and sadly often fatal condition.
That's right. And you've asked us to unpack the complexities of what's formerly known as Actinobacillosis.
We have indeed. We've got your source materials here, research excerpts, specialist study guides the works.
And we've distilled all that down, aiming to give you a real shortcut to getting properly informed on this.
So our mission today is to guide you through the basics, what causes it, how it hits the foals, diagnosis, and crucially, treatment and prevention. Expect some aha moments, I think.
Definitely some surprising facts and practical insights that go, way beyond just scratching the surface.
Okay, let's dive in. To start, what exactly is sleepy foal disease at its core? What makes it sleepy?
Well, that sleepy part, it comes directly from one of the main clinical signs, this profound lethargy, just a deep depression in the foal.
So they look sleepy, but it's actually severe illness.
Precisely. It's an acute, rapidly progressive septicemia. Basically, a severe bacterial infection that spreads throughout the bloodstream, and it primarily affects newborn foals.
Right, septicemia, and the specific bug causing this.
The main culprit is a gram-negative bacterium called Actinobacillus equuli.
Actinobacillus equuli.
Okay, and here's what's really fascinating, or maybe worrying. This bacterium, while it causes this severe disease, it's also a completely normal resident in healthy adult horses.
Really? So it just lives there harmlessly most of the time?
Yeah, it's a commensal. You find it in the mouth, the upper respiratory tract, the gut, even the genital tract of healthy adults. It only really becomes pathogenic, disease-causing when it multiplies like crazy or the foal's defenses are down.
That's quite the double life for a bacterium. Are there different strains we should know about?
There are two main subspecies. A. equuli subspecies equuli. That one's non-hemolytic, and it's the main cause of this sleepy foal disease.
Okay.
Then there's A. equuli subspecies hemolyticus. It's hemolytic, less common in the specific disease, but it can cause respiratory problems.
Good to know. And I see here it's a biocontainment level 2 organism.
That's right. Standard lab precautions needed, nothing too exotic, but you handle it with care.
Got it. So given how dangerous this can be for foals, who exactly is most at risk? And how does this normally harmless bacteria actually get into these vulnerable little guys?
Well, its primary targets are definitely neonatal foals. Those first 2 days are critical.
How early are we talking?
The really severe acute cases. We usually see them within the first 1 to 3 days of life, though generally any foal under about 2 weeks old is susceptible.
And adults, you said it lives in them normally.
Adults are rarely affected systemically, throughout the whole body. If they are, there's usually some other underlying condition weakening them. It can occasionally affect pigs too, believe it or not.
Huh. Interesting. Okay, so focusing on foals, where does the infection actually come from?
2 main sources, really. Healthy mares can be carriers, having the bacteria in their genital or upper respiratory tracts without showing any signs themselves.
Okay, so the mare herself.
Yes. And the other big one is the environment. Unsanitary foaling conditions are a major contributor. Dirty stalls, contaminated bedding.
Right. So the mare or the environment, how does it then jump from there into the foal? What are the pathways?
This is where it gets really critical for understanding prevention. There are multiple routes. It can happen in utero.
Before birth, through the placenta.
Exactly. Transplacental infection. Or it can happen during birth itself, parturition. Direct contact with the mare's infected genital tract, or maybe even her saliva.
Okay, in utero or during birth. What about after the foal is born?
Postnatal routes are really common. A huge one is infection through the umbilical cord stump.
Ah, the navel, often called navel ill, right?
Precisely.
Yeah.
That's a major highway for the bacteria to get into the bloodstream. But also ingestion, swallowing the bacteria from a contaminated environment, or maybe from the mare.
Eating it, essentially.
Yeah. Or even just breathing it in inhalation.
Wow, so many potential ways in. It really highlights the need for good management. This leads us to risk factors then. What makes one foal more likely to get sick than another?
There's one absolutely major predisposing factor. It's failure of passive transfer, or FPT.
FPT, that's about colostrum, isn't it, the first milk?
Exactly. It means the foal hasn't absorbed enough of those protective maternal antibodies from the mare's colostrum. That first milk is packed with immunity. Without it or without enough of it, the foal is incredibly vulnerable.
So FPT is number one. What else?
Definitely that unsanitary foaling environment we mentioned. Any concurrent disease that weakens the foal's immune system. And then there are maternal factors, things like dystocia, difficult birth or placentitis, inflammation of the placenta in the mare. These can increase the risk of infection happening before or during birth.
Makes sense. So, okay, the bacteria gets in through one of these routes. What does it do inside the foal's body? How does it cause such rapid and severe disease?
Well, once A. equuli hits the bloodstream, maybe via the navel, the lungs, or the gut, it spreads incredibly fast. It disseminates throughout the body, leading to that septicemia we talked about.
A full body infection.
Right. And what's really characteristic of this particular bacterium is its tendency to sort of lodge in tiny blood vessels, the small capillaries, especially in the kidneys.
Kidneys specifically.
Kidneys are a prime target. It forms these little pockets of infection, microabscesses. This pattern of spreading through the blood and settling in organs, we call it embolic spread, is really a hallmark of the disease.
So it travels the bloodstream and sets up shop in specific places. Kidneys are one. What else?
Joints are another really common site. It causes purulent polyarthritis and polysynovitis, basically. Pus-filled inflammation in multiple joints. People often call this joint ill.
Joint ill. Which joints are most common?
Often the hock and stifle joints. You'll see painful swelling, lameness. It's quite nasty.
So kidneys and joints are key targets. Does it stop there?
Unfortunately, no. It can hit other organs too. The lungs, causing bronchopneumonia, the liver, leading to small abscesses there, even the adrenal glands, the heart, causing endocarditis, an infection of the heart lining.
Wow. It really gets everywhere.
Can. The gastrointestinal tract might show signs like diarrhea, sometimes bloody hemorrhagic enteritis. And though it's rarer, it can even affect the meninges, the membranes around the brain and spinal cord, causing meningitis.
And you mentioned it's gram-negative. That has implications too, right?
Absolutely. Being gram-negative means when the bacteria break down, they release endotoxins. These are powerful toxins that massively ramp up the body's inflammatory response, causing a lot of the systemic shock and organ damage we see. It's a double whammy, the bacteria themselves and the toxins they release.
That really paints a picture of an internal battle. So what does this look like on the outside? If you're looking at a foal, what are the warning signs?
You typically see two main forms. The first is the paracute or acute form. This is the classic sleepy foal.
The one that gives it the name.
Exactly.
Yeah.
It usually hits within the first 24 to 48 hours of birth, and it's incredibly severe. The foal is just profoundly lethargic, depressed, unresponsive, looks deeply sleepy.
Okay. What else?
Weakness, they often can't stand or nurse properly. They might have a fever, but actually it's more common to find hypothermia, a dangerously low body temperature.
Oh, temperature. Okay.
Diarrhea is common, and it's often hemorrhagic, bloody. You see a rapid decline in their cardiovascular status, maybe petechial hemorrhages, tiny little red spots on their gums or inside their eyelids.
And the prognosis here is not good.
It's very poor. Death often occurs very quickly, sometimes within just 1 to 3 days. It's brutal.
Terribly fast. What if they somehow survive that initial onslaught? Is there another form?
Yes, if they pull through the initial septicemia, they might develop the subacute or chronic form. This shows up days to weeks later.
And what does that look like?
This is where you often see the localized signs more clearly. Joint ill becomes prominent, swollen, hot, painful joints, causing obvious lameness.
Right, the joint ill.
They might develop clear signs of pneumonia, faster breathing, difficulty breathing, maybe a cough or nasal discharge. Kidney damage might be significant internally, even if not obvious clinically in a young foal. And you might see that omphalophlebitis, the infected navel stump, swelling, pain, maybe discharge.
So localized infections become the main issue.
Yeah, along with just a general failure to thrive. They don't grow well. They look emaciated.
Okay.
So you see these signs. You suspect Sleepy Foal Disease. How do you confirm it? How's the diagnosis made?
Well, the first step is always strong clinical suspicion. Seeing those typical signs in a very young foal, especially if you know there are risk factors like FPT or maybe the foaling wasn't perfectly clean.
Clinical picture first, then labs.
Then you move to diagnostics. For a live foal, the gold standard or preferred sample is a blood culture.
Trying to grow the bacteria from the blood. Exactly. A positive culture for A. equuli is highly indicative. The downside is it can take 48 hours or more to get results, and you need to start treatment way before that.
Right. Can't wait that long. What else?
You can try to culture other fluids if specific organs seem involved, like taking a sterile sample of joint fluid, synovial fluid if you suspect joint ill, or a tracheal wash if pneumonia is suspected, or even urine.
Makes sense. What about general blood work? CBC, chemistry.
Oh yes, very important. A CBC might show changes in white blood cells, Maybe high, maybe low, often what we call a left shift, meaning lots of immature neutrophils being pumped out, indicating severe inflammation.
Signs of the body fighting hard or being overwhelmed.
Exactly. You might see low protein levels, high fibrinogen, other inflammatory markers. Biochemistry might show kidney or liver enzyme changes depending on organ damage.
And you'd still test for FPT at this stage.
Absolutely critical. Every septicemic foal should be tested for FPT using something like an IgG SNP test or radial immunodiffusion. It confirms that major risk factor and helps guide treatment, like needing plasma.
Okay, and if the foal doesn't make it?
Then a post-mortem exam, a necropsy, gives the definitive diagnosis. You look for those characteristic gross lesions, especially the multiple little greenish-yellow purulent spots, those foci, in the kidney cortex.
The kidney lesions are really key then.
They are highly characteristic. Plus, histopathology, looking at tissues under the microscope and culturing bacteria directly from tissues like the kidney and lung will confirm A. equuli.
And you have to rule out other bugs too, presumably.
Definitely. You need to differentiate it from other causes of neonatal sepsis. Things like E. coli, Salmonella, Klebsiella, various Streptococcus species can all cause similar signs, including joint ill or pneumonia.
Right, okay. So diagnosis is confirmed, or at least highly suspected. How do you fight back? What's the treatment approach?
The absolute key is urgency. Early and aggressive intervention is crucial. It can make the difference between life and death.
So hitting it hard and fast, what's the first line of attack?
Antimicrobials. Broad-spectrum antibiotics need to be started immediately, as soon as you suspect sepsis, even before you have culture results back.
Which ones typically?
Common choices are combinations. Often a beta-lactam like penicillin or ceftiofur, paired with an aminoglycoside like gentamicin or amikacin.
Yeah.
You have to be careful with aminoglycosides and monitor kidney function, though. Potentiated sulfonamides or tetracyclines might also be options depending on the situation.
And you adjust based on culture results later.
Exactly. Once the culture and sensitivity results are in, you tailor the antibiotic choice to what the specific bacteria is most susceptible to. And treatment isn't short. It often requires several weeks, especially if you have those deep-seated joint infections.
Weeks of antibiotics. What about supportive care? That sounds critical for these fragile foals.
It's absolutely vital. You can't just rely on antibiotics. Fluid therapy is essential to correct dehydration and electrolyte imbalances.
IV fluids.
Yes, intravenous fluids usually. And if the foal has FPT, plasma transfusion is critical. It provides those missing antibodies and helps support blood pressure.
Giving them the immunity they didn't get from mom.
Precisely.
Yeah.
We also use anti-inflammatory drugs, NSAIDs like flunixin meglumine, to manage pain and inflammation, especially with joint ill.
Makes sense. What if the joints are really bad? Or the navel?
For severe joint infections, sometimes joint lavage is needed, basically flushing the joint out under sterile conditions to remove pus and debris. And if there's significant navel infection, omphalophlebitis, sometimes surgical removal of the infected umbilical remnants, an omphalectomy, is required.
So potentially surgery, too.
It can be part of it. And then there's all the general support, nutritional support, maybe feeding via nasogastric tube if they can't nurse. Meticulous nursing care, keeping them warm, dry, clean, turning them regularly if they're down. It all adds up.
It sounds incredibly intensive and challenging. So what's the bottom line? What's the typical outcome, the prognosis?
Honestly, the prognosis is generally guarded to poor. Sleepy Foal Disease carries a high mortality rate, particularly that parakeet form we talked about, where death can happen so fast.
Guarded to poor. Are there things that make it lean one way or the other?
Definitely. The age of onset is a big factor. Foals showing signs very early, like within the first day, tend to do worse.
Yeah.
The overall severity of the sepsis, how lethargic they are, how many organs are involved, all negative factors.
And FPT.
Foals with FPT definitely have a significantly worse prognosis. Their immune system just isn't equipped for the fight. On the flip side, how quickly and aggressively treatment is started makes a positive difference.
So early intervention helps. What about long-term if they survive the initial phase?
If they survive the sepsis but have those chronic localized infections, like severe joint ill, they can face a long recovery and potentially long-term issues like chronic arthritis or lameness. The reported survival rates for foals with Actinobacillus bacteremia hover around 43%.
Less than half. Wow. That really underscores the need for prevention.
Absolutely. Prevention is where you can make the biggest impact. It really boils down to two main things: reducing the foal's exposure to the bacteria and maximizing the foal's own defenses.
Okay, let's break that down. Maximizing defenses, that sounds like colostrum again.
It is paramount. Colostrum management is number one. Ensuring adequate passive transfer. That means making absolutely sure the foal nurses effectively within the first hour or two of birth.
Get that good stuff in early.
Yes, and get enough of it. And ensuring the colostrum is actually high quality. You can test the mare's colostrum beforehand for IgG levels.
Test the mare's milk.
Yep. And then crucially, test the foal's blood IgG levels at around 12 to 24 hours of age.
To see if they actually absorb it.
Exactly. If that test shows FPT, failure of passive transfer, you need to intervene immediately. That means giving plasma transfusion or maybe high-quality oral colostrum or a commercial IgG supplement. Don't wait.
Okay, colostrum management is huge. What about reducing exposure? The environment.
Environmental hygiene is vital. Strict cleanliness in foaling stalls or areas, thorough cleaning, and disinfection between foalings is key.
What if they foal outdoors?
If foaling outdoors, try to rotate pastures if possible. Don't use the same small paddock over and over to reduce pathogen buildup. And always, always promptly remove the placenta and any soiled bedding after foaling.
Makes sense. And the umbilical cord care.
Yes, umbilical care is important. Disinfecting the umbilical stump shortly after birth using a suitable antiseptic dilute chlorhexidine or iodine solutions are common choices, and repeating that maybe a couple of times a day for the first few days.
Dip the navel. Got it. What about managing the mare?
Good mare management helps too. Addressing any reproductive tract infections she might have or issues like placentitis before she foals can reduce the risk.
Is there anything like washing the mare's back end or giving her antibiotics before foaling?
That's actually a bit controversial. Things like vaginal lavage or putting antibiotics in the mare's birth canal aren't universally recommended. The evidence for their effectiveness is debated, and there's always the concern about promoting antimicrobial resistance.
Okay, so focus on hygiene and colostrum mainly. What about giving antibiotics to the foal preventatively? Prophylaxis.
That's another area for careful consideration. In foals deemed very high risk, maybe known FPT, or born into a really contaminated environment, a vet might consider prophylactic broad-spectrum antibiotics.
But it's not routine.
Definitely not routine. It has to be weighed very carefully against the significant risk of contributing to antibiotic resistance. It's a judgment call for the veterinarian in specific high-risk scenarios.
Right. Well, this has certainly been a deep dive. We've covered a lot. From the bacterium itself, Actinobacillus equuli, living normally in adults but causing havoc in newborns,
To the critical role of colostrum and passive transfer, the different ways foals get infected, the signs, diagnosis.
treatment challenges, and most importantly, those prevention strategies focusing on immunity and hygiene. This kind of detailed understanding, it really turns basic information into useful knowledge, doesn't it?
It really does, and it highlights that complex interplay between a microbe, the host's defenses, and the environment.
It makes you think, doesn't it, how this bacterium, which is just a normal inhabitant for many horses,
Can become so devastating when those foundational protective elements, like a foal's brand new immune system getting that colostrum boost, are compromised or missing.
it definitely raises a broader question to ponder. What other seemingly harmless things, maybe bacteria or other elements in our environments, could suddenly become dangerous if our own fundamental defenses are weakened?
That's a really interesting thought to carry away, something for you all to mull over until our next deep dive.